Diabetes is a silent assassin. At the end of last year, we had a high school reunion. We met friends for the first time in years due to COVID-19 and had dinner at a buffet restaurant. Hello? This is your Health Digest channel. We always produce videos for your health management with information from Korean health management specialists and researchers in related fields. Is there anyone who hasn't subscribed yet? Please subscribe and like right now. And please share it with your loved ones so that we can all live healthy lives. For reference, the average life expectancy of Koreans is currently 90 years for women and 86 years for men as of 2024, which is one of the longest average life expectancies in the world. It has increased by more than 5 years compared to 10 years ago, and the average life expectancy of Koreans is increasing every year. I hope you all always watch our Health Digest videos and maintain a healthy life. Buffet means freely choose in French, and it refers to a meal where you choose various types of food yourself at a restaurant. I don't really like buffet restaurants where you can eat a variety of foods without restriction. This is because I often end up overeating because I can't control myself due to the variety of flavors. While chatting, I looked at what my friends and people around me were eating. Some people only eat meat and don't touch vegetables, some eat seafood and fish, some eat a little bit of each type, and some drink carbonated drinks instead of water. I can't be 100% sure, but I can say that buffet restaurants are places where your usual eating habits are reflected quite transparently. There were 6 people sitting at the same table, and 2 of them didn't eat fried food and ate very little, so I asked why, and they said they had been suffering from diabetes for a long time. So they have to be careful about what they eat, and they said that coming to a buffet restaurant is a great humiliation. In this way, in modern society, a variety of abundant food is a double-edged sword that can be both a blessing and a threat. Underlying disease is a medical term that refers to a disease that is the cause or foundation of a disease, and is also called a chronic disease. Diabetes is a representative underlying disease and chronic disease. In 2021, when COVID-19 was at its peak, the Korea Disease Control and Prevention Agency announced that about 95% of the deaths due to COVID-19 infection were patients with severe underlying diseases. Patients with underlying diseases have weak immunity, so they are more easily infected when exposed to the virus under the same conditions, and their recovery speed is slow, and it is difficult to completely cure them. Representative underlying diseases include diabetes, high blood pressure, lung disease, renal failure, asthma, and tuberculosis, and most of them are chronic diseases or chronic diseases that last for a long time. Underlying diseases are dangerous in themselves, but they are very likely to develop into more serious diseases or cause various complications, so they require more thorough management. Chronic diseases are usually the result of aging accumulated throughout life, and as with most diseases, diabetes is a disease that is particularly difficult to manage because we must pay special attention to the types and amounts of food we normally eat. In the 1960s, diabetes patients in Korea were a rare disease, accounting for only 1.5% of the total population. However, according to data recently published by the Korean Diabetes Association, Diabetes Fact Sheet in Korea, 2022, the number of diabetes patients in Korea is rapidly increasing, with about 16% of adults over the age of 30 suffering from diabetes. In other words, 1 in 6 adults is diabetic, which is a very high rate worldwide. A more serious situation is that the age of onset of diabetes is rapidly decreasing to under 40. Various studies have revealed that the reason for the rapid increase in diabetes patients and the decrease in the age of onset is closely related to lifestyle habits, such as eating habits. What is the problem? To find the answer, it is important to properly understand diabetes. Diabetes is a type of metabolic disease that occurs when the pancreas secretes insufficient insulin or does not function properly, and is characterized by hyperglycemia, which is an increase in the concentration of glucose in the blood. To understand diabetes, you must first understand insulin. Insulin is a hormone secreted by beta cells in the islets of Langerhans in the pancreas, which is derived from the Latin word insula, meaning island. It is a very important substance that plays a role in maintaining a constant amount of glucose in the blood within the human body. It is a very important substance that plays a role in maintaining a constant amount of glucose in the blood within the human body. When we eat food and our blood sugar level increases, Insulin is secreted from the pancreas to allow glucose in the blood to enter the cells and be stored in the form of glycogen. It also helps in the oxidation and conversion of glucose into fatty acids in adipose tissue and promotes the absorption of amino acids for protein synthesis in muscles. If this insulin is deficient or malfunctions, the uptake of glucose in cells decreases and the amount of glucose released from the liver increases, leading to a state of high blood sugar or diabetes. Due to high blood sugar, you feel thirsty and drink a lot of water, and the amount of urine increases, making you go to the bathroom frequently and excreting a large amount of glucose in your urine. Diabetes is largely divided into types 1 and 2. Type 1 diabetes is also called juvenile diabetes and is caused by a congenital inability to produce insulin at all. Type 2 diabetes is characterized by insulin resistance, where insulin's function to lower blood sugar levels is relatively low compared to normal people, and cells cannot effectively burn glucose due to reduced insulin function. Type 2 diabetes is often caused by lifestyle habits, such as eating habits. In other words, acquired and environmental factors such as irregular high-calorie, high-carbohydrate, high-protein, high-fat diets and lack of exercise play a major role, and it can also be caused by defects in certain genes, pancreatic surgery, or infections. Diabetes, which has more serious complications, is often called a silent killer. The fear lies in the fact that most people do not feel any abnormal symptoms in mild hyperglycemia or mistake it for other causes, making it difficult to think of it as diabetes. If the flesh is torn or the bone is broken, it can be treated immediately. If you have a high fever or a bad cough, you can get a diagnosis and a prescription. Diabetes is not recognized until acute or chronic complications occur, and the appropriate treatment period is often missed. If hyperglycemia continues, the elasticity of blood vessels decreases and hardens, causing arteriosclerosis, which causes blood flow to stagnate and can worsen into serious vascular diseases, angina, myocardial infarction, cerebral infarction, etc. The kidneys and eyes also become abnormal. If the capillaries of the kidneys are blocked or damaged due to diabetes, diabetic nephropathy occurs, which causes the kidneys to gradually fail to excrete waste products, leading to chronic renal failure. If the capillaries in the retina of the eye are blocked or destroyed, diabetic retinopathy occurs, and if it gets worse, it can lead to blindness. Nerve problems can also occur, damaging the nerves in peripheral areas such as the hands and feet, causing sensory abnormalities such as numbness and tingling. Autonomic nervous system problems can cause dizziness, sweating disorders, digestive disorders, urination disorders, and sexual dysfunction. In this way, diabetes can cause various complications. Diabetes is a terrible disease that causes serious complications from head to toe, to the point that kidney disease, retinal disease, and nerve disease caused by diabetes are called the 3 major diabetes complications. Glucose toxins are a diabetic complication accelerator. Everyone around you says diabetes, so you think of diabetes too lightly. However, the more you know about diabetes, the more dangerous it becomes. If diabetes persists for a long time, daily life itself becomes lethargic, so it can be said that the mental damage is greater than any other disease. According to statistics, 30% of people with diabetes suffer from depression, which is 2 to 3 times higher than the general population. Diabetes treatment is sometimes likened to a marathon, not a 100-meter dash. Even if you have the same disease, the treatment effect varies depending on your mindset, so you should exercise hard while maintaining a regular low-calorie diet along with appropriate medication with a positive mindset that you can overcome and treat it. Diabetes patients with chronic high blood sugar levels produce more glycation end products, advanced glycation end products, than normal people, and they cannot help but continue to accumulate. Glycotoxins are toxic substances that combine sugar and protein, and they are important causes of aging, dementia, diabetes, liver disease, obesity, vascular disease, and various chronic diseases and chronic inflammation by transforming cells and lowering the functions of major organs. They are also accelerators that worsen specific diseases and act as inhibitors that delay treatment. Major organs that have weakened functions due to excessive glycation end products can become targets of diabetic complications. Diabetes, if not properly treated and managed, can lead to diabetic complications. Sugar toxins act as kindling that causes specific diabetic complications or as a fatal factor that worsens various diabetic complications, like adding fuel to a burning fire. When looking at it comprehensively, managing sugar toxins is one of the most important points in treating diabetic complications. For example, even among the same diabetic patients, sugar toxin levels in the body can vary. Even if the postprandial blood sugar level is the same at 200 milligrams per deciliter, you can reduce the onset and worsening of diabetic complications by practicing good eating and living habits and utilizing food ingredients and proven new materials that help detoxify sugar toxins. In order to prevent the silent assassin diabetes, proper eating habits and regular exercise are important. In addition, it is very important to properly prevent and manage sugar toxins. This is because managing sugar toxins can prevent terrible diabetic complications. Was today's content helpful? Don't forget to subscribe and like and turn on notifications. Be sure to click all of them right now. I'll be back next time with more useful content from Korean healthcare experts. Thank you for watching.